Hello, my name is Michelle Rhodes and I'm the Director of Nursing here at ULHT. I'm here today along with some of my colleagues to explain what it is that we do on a daily basis to keep you and our patients safe around safe staffing, for nursing in particular and midwifery. I understand all the pressures that you have on the wards. I know how difficult it is at the moment. I spend a lot of time walking the wards and see how hard everybody's working, and I'm really grateful for that, as is the Trust Board and the whole organisation for the way that everybody has pulled together, particularly over the winter months when we've had all these extra beds open. So the whole purpose of this video today is for you to see what happens on a daily basis. So we're going to work through this right from the ward up to the Trust Board, and you can see what happens. I hope you find it useful.
My name's Tina. I'm a sister on Shuttle ward at Lincoln County Hospital. Part of my daily routine is when I come in at 8 o'clock in the morning is to ensure that the ward is actually staffed at that immediate time and for the 24-hour period. If there are any staffing issues, we then look with the coordinator at the patient acuity. If there is a staffing shortage and we've noticed that acuity is high and we need to cover this, it is then escalated to the matron. Also, if there's a staffing shortage over that 24-hour period that I cannot sort out myself with our own staff, again, this is escalated to matron.
Hello, I'm Catherine, matron for surgery and orthopaedics. When I arrive at work on a daily basis, I go around all my areas to review the staffing levels within my patch to try and make sure it's safe. So I'll go to each of my wards, pick up what the staffing levels are for that morning. The ward sister will then at that point escalate any staffing issues to me, any patient safety concerns regarding that staffing levels. And then once I've done all that, if I can fix any issues I've got with staffing within my own area and make each area as safe as I possibly can through moving staff around, then I'll do that as an immediate action. But then failing that, as a group of matrons, we have an operational matron of the day which is planned for in advance so that we've always got somebody operationally on the site managing the staffing levels on a daily basis. So as the operational matron, we'll then collect the staffing from the site duty manager, and then we have a staffing meeting at 9 o'clock where all the individual matrons or the representative will bring their staffing levels for their area. At that point, we look at the staffing then for the whole site, and we'll review not just the staffing levels but the acuity and dependency of patients, and we will then redeploy staff as required dependent on patient safety. And that will mean that we may have to take areas below their usual template to make other areas safe, but as professionals we do that in a safe and controlled manner. Once we've done that, if we're still short across, we look at other areas such as x-ray, endoscopy, theatres, anywhere else that we can maybe redeploy staff from to help support the individual areas to make them safer still. And we do this throughout the day at regular intervals, so we review staffing at 9 o'clock, at 1 o'clock and then again at 3 o'clock before we hand back over to the site duty managers at night. And when we hand over to the site duty managers, we have a clear plan for the staffing for overnight. And on a Friday, we do a full weekend plan for the staffing as well. But I think once we get to a level where we can't do any more with the staffing, we then escalate that over to the heads of nursing.
My name's Linda Keddy. I'm Head of Nursing for Surgery, Theatre and Critical Care at Pilgrim Hospital. As Operational Head of Nursing of the day, we liaise regularly with the operational matron. We have a standard operating procedure that allows them to escalate to us on a daily basis what the staffing levels are for each of the ward areas. When I've got a picture of the early, the late and the night shift, I then liaise with Michelle Rhodes, our Director of Nursing, and I'm in regular contact with Michelle throughout the day so that she's aware of what the issues are on our site, and she's also aware of what overtime we are required so that she can authorise it.
So on a daily basis, the head of nursing, whether that's Linda or one of the other heads of nursing from the other sites, will contact me if they've got concerns about staffing and patient safety, and I'll have a conversation with them. We'll go through the wards, ward by ward, so that I can understand what the template is, and I'll agree either overtime or extra agency nursing or whatever it takes to maintain the patient safety on the sites. So every day I get that information, I have those conversations, and also Health Rosters send me the information on a daily basis about what the fill rate on our wards is. So over the last 6 months or so, since we have increased the rate of pay for bank, our fill rate has actually improved. So we've gone up from about 85% fill rate to about 95%, and I can absolutely understand that it doesn't feel like that on a daily basis, but that's because the wards are so busy, the patients are so poorly, and because we've got more beds open because of winter at the moment. But I do see this information on a daily basis. Every month as well, I talk to the Trust Board about the nurse staffing levels. They get the reported numbers of nurses that have been on the wards, and that's broken down into paediatric nursing, general nursing and into midwifery. So you need to really be clear that myself and all the execs are aware of how hard everybody's working at the moment, and we're doing absolutely everything that we can to keep you all safe and to keep patients safe as well.